New tonight at 6. We've known the new Omicron BA.5 subvariant has sparked the surge in COVID cases that we've been seeing, but now we know just how dominant it's been. This new variant caused nearly 80% of new infections across the U.S. last week, up from 69% the week before, all according to a new update out today from the CDC. It is also driving a wave of breakthrough infections and reinfections that has caused health officials to warn the public to pay attention to COVID levels in their communities. It's why health officials are warning people to take actions to slow the spread. For example, wearing masks indoors and taking rapid tests before you go into a big gathering. And that applies especially to people whose counties have high COVID levels right now. More than half the state of Arkansas in the red on that map you see there. Everyone in these counties, including Pulaski, almost all of central Arkansas, is asked to mask up in public. And of the remaining counties, most are in yellow. That means masking is recommended for people at high risk. The good news is this latest strain seems to be a little bit more mild, and it's not impacting hospitalizations like we've seen in the past. But there's still some concerns with it, most significantly the one that comes from the long-term side effects, or long COVID. The CDC estimates nearly 1 in 5 Americans who've been infected have dealt with long COVID, or when the symptoms last 3 months or longer. CBS News chief medical correspondent Dr. Jon Lapook went on CBS Mornings today discussing that recent study into long COVID from the NIH. And in the interview, he was asked about the chances of long-term side effects with this new variant.
It does turn out that if you were vaccinated, you do lower the risk of getting long COVID. But these kind of questions about what are the risks and who are the populations who get it and what to do about it, these are all things that we're trying to figure out.
The doctor also addressed questions about how people can tell if they're dealing with long COVID symptoms, since it's not something that shows up on a test. Here's what he had to say.
It is so frustrating for people because they feel lousy, and some people really are debilitated. But there's no specific blood test, there's no brain scan, there's no CAT scan, there's nothing on physical exam that specifically says you have long COVID, and that's one of the things they're trying to look for.
The study does continue. They're looking for people to join up. Specifically, they're looking for more people who are Hispanic and kids of all ages. For more information, just head over to recovercovid.org.